Of that, and let's talk about the food. Tell me your jollof experience.
Look, I think the one thing that I know, one has to be very prepared for the spiciness.
Thank you.
But I absolutely love it. But what I know not to get into is the Ghana, Nigeria, jollof war and pig side.
That was really smart. I wanted to jump into you with that to say, what do you think about Ghana and jollof? Because I know you've been moving around Africa, but it's okay. It's good. I love the dodge. You dodge that. I love it. But let's dive straight to it. I mean, the reason why you are here, the fact that you have also, I mean, being in the industry where life is most concerned and where saving life is most concerned, and that also shows in your track record. I mean, for you to also be the chairperson of Pharmaceutical Task Force, more like we would call it force here, to ensure that the right thing is done. I mean, you are here for Africa Business Health Conference, and I understand that you gave a presentation on accelerating the end-to-end elimination of cervical cancer, which is also a very crazy killer when it comes to the health of people. Can you give us a synopsis of that presentation, and what are the key message that you put across?
Yeah, it really was a good conference and attended by a multitude of stakeholders, manufacturers like ourselves, stakeholders from the NPHCDA that look after primary healthcare in the country, and then private market healthcare providers. And for us, it was really important that we contextualize why cervical cancer is such an important topic. And use a sort of Nigerian context thing that we hear. Just to give you an understanding of the numbers, in Nigeria, every year there's 12,000 new cases of cervical cancer.
Oh, wow.
8,000 of those people will die. And it's a preventable disease. There's a vaccine that can be administered that prevents a large majority, about 70% of cervical cancer. And so for us, it was important to contextualize those numbers, but also really celebrate the progress that the country of Nigeria has made. If memory serves me correctly, the first conversations around a cervical cancer elimination policy started in Nigeria around about, I think it's about 2014. In 2023,
yes,
there was the introduction of an immunization program where they were vaccinating young children. As of this year, between 2023 and now, the country of Nigeria has vaccinated approximately 14 million girls.
Wow.
And the impact that will have is you can't begin to imagine it. I grew up in South Africa in the late 80s to 90s, 2000s, at the height of the HIV pandemic.
Yes.
And making a concerted decision to intervene in a pandemic in the way that the government of Nigeria has will certainly have a long-lasting impact, like the impact of introducing ARVs in South Africa back then. So that was the context, and it was really just reminding us of the impact that we've made and what we still need to do.
Interesting. I mean, just looking at the number and how much you've conceptualized it, and looking at 8,000 people as to the 12,000 people who, I mean, will die if they don't also get. Do you think we're doing enough advocacy for people to know that there are vaccines for this?
Look, we're trying. I think collectively there's a lot of effort going in, but I think we can always do more.
Okay.
I think with the advent of social media, it makes it even more difficult, but even more so important for us to be vocal about this. There's misinformation that spreads around. And so we try and ensure that wherever we go, we're able to engage with policymakers as well as community, people within the community, including religious leaders, and provide them with the information to ensure that we utilize every single vehicle and avenue that we've got to get the right messages out there.
Let's talk about MSD for a minute. Even though I know you'd want to stay humble about it, but let's talk about the fact that it's also a leading global manufacturer of HPVs. But then again, you also want to put that side by side, and I'm happy I'm talking to you because you are the right person to talk about this. Also want to look at affordability of some of these vaccines. Yeah. What are you doing in terms of affordability for people to be able to maybe walk in and get some of these vaccines?
Yeah, so I think our partnership and the vaccination program that we've got in partnership with the government of Nigeria is an excellent example of our efforts around expanded access and making sure that we deal with the affordability challenge. We have a specific way of servicing the needs of low and middle income countries. And we've worked with UNICEF and Gavi, where we provide them with deeply discounted pricing. And it's through that partnership that these low and middle income countries can roll out these large scale programs. So it deals with the affordability aspect because, the thing with being a research orientated company, you can develop the most innovative medicines, but if they're not used by the people that need them, it means absolutely nothing.
True.
And so I think if you look at our impact across the continent, we did a calculation on last year's number, and at the end of last year, just for the year, that 12-month period, we vaccinated approximately 17 million girls on the continent. When I started in the role, we closed 2021 having vaccinated, it was just under 7 million. So you can see the annual growth year on year. That, first year we're vaccinating 17 million. By the end of last year, I think it's like 4 years down the line, we're vaccinating about 17 million a year.
Wow.
And that speaks to access.
Of course, it does. The numbers are there, and it really speaks to access. Let's narrow down a little focus on the MSD in terms of innovative medicines. What are innovative medicines, and how important are they, of course, in the Nigerian healthcare space?
Yeah, so MSD, as you said, is one of the top pharmaceutical manufacturers in the world. We purely exist to leverage the power of science and innovation to deal with specific unmet healthcare needs. And so research and R&D is the cornerstone of what we do. And we've already spoken about the fact that our portfolio consists of vaccines, of which the HPV vaccine is let's call it the marquee vaccine there. But there are more coming, including RSV, which is very important for pediatric respiratory challenges. And then the other key portfolio that we've got is oncology, which is cancer care. We've got the number one pharmaceutical product in the world. It's an immuno-oncology drug. It's a cancer product. And it's a product that has really revolutionized the space of cancer care because all of a sudden you've taken cancers that were, a death sentence to a place now where people have a real opportunity for extended quality of life. I think for us, particularly our sub-Saharan Africa cluster, the key focus is to ensure that those innovations are able to be accessed by as many Africans as possible. And so we spend just as much effort as we do on the, innovation, the research and the development. We exert that same level of energy on, expanded access programs, finding ways and means of ensuring that as many people as possible are able to get those treatments. I'm happy to say that we recently registered this product in Nigeria.
Oh, great.
2 or 3 months ago.
Good.
We will be commercializing and launching. We've started the process of engaging with various stakeholders in the country to ensure that we're able to create a viable route to all patients.
Oh, great. So are we looking at a launch in Abuja?
Yeah.
Oh, great.
So we should be launching either Q4 of this year or Q1 of next year. It just depends on when we can get product into the country. But certainly, all sort of systems are firing towards establishing.
Make sure that happens. You can catch us on YouTube this morning. We're on YouTube having this conversation. So on YouTube is at Nigeria Info Abuja, and Facebook is also at Nigeria Info Abuja. So catch us on YouTube right now on this conversation. In as much as we talk about the numbers, the advocacy, and the fact that you also say we can do more in terms of accessibility, our policy is also the driving force for that. You know, what policies are put in place. But with your level of experience, I mean, what policy do you think, or would you be suggesting to the government to put in place or to promote the accessibility to innovative medicines from your experience? What are the biggest barriers in terms of accessing innovative medicines?
I think if I look
especially in the region.
Yeah, I'm going to look at it in two ways. So I think, you know, cancer care, including cervical cancer, it really starts with, does, you know, each country have a prevention policy in place? I think Nigeria has done really well in terms of their cervical cancer prevention policy. It's quite clear, it's quite progressive, and it also actually includes boys, where they're saying where there's capacity, they will expand the vaccination to boys as well. So I think Nigeria has done incredibly well. And we tend to use Nigeria as a lesson for other countries that we go to in order to just say, perhaps, you know, you should
copy from Nigeria.
You know, and I think that's something that we generally need to do is to steal with pride things that are progressive
and replicate
because it builds speed. I think the one thing that I'm very passionate about, though, particularly at a regional level, is I think our countries and our governments have not yet leveraged the power of pooled procurement. Each country is doing their own thing. And you've got 54 different countries that need to be serviced, different levels of population sizes and affordability. If we would coalesce our financial resources as, you know, the ECOWAS region or the East Africa region and approach manufacturers of critical medicines and say, we've got a population of X million people. Here is our budget. We would like to engage in a discussion around volume-based discounting. You would find that the cost of medicines would decline or decrease significantly.
Interesting.
I think, you know, we've been speaking about it. We spent quite a lot of time talking about that at the conference yesterday as well. And certainly I think that I'll continue to make that call, as well as many others like me. But I think there is a large degree of support for it.
Interesting. I mean, a lot of people will say MSD is known for mothers, you know, for a lot of mothers and mother care and all of that. Tell us about the company's presence in the country and the impact it has made so far.
Yeah, we've got a foundation, a global giving foundation that is called MSD for Mothers. It operates completely independently and outside from my commercial business. And what it does is it invests in and supports endeavors, around maternal health. And we have a number of projects that we've invested in Nigeria. In fact, we've got an MSD for Mothers representative that lives in Lagos, and she ensures that the projects that we invest in and the projects that we participate in are executed and have the outcomes that were anticipated. I think on the African continent, the largest, Nigeria is probably one of the top two in terms of the recipients of support through the program. And it really speaks to the fact that for us, it's a non-negotiable, it's not a commercial thing. It's about making sure that reduce maternal, pediatric death during pregnancies or birth, and improve maternal health generally.
Interesting. And then for people who are listening who would say, I want to check out what the foundation is doing, especially the fact that we'd also have in Nigeria, how can they connect with the foundation?
They can just go online. If you go into Google, you search MSD for Mothers, you'll find a wealth of information and it details every single project that we participate in.
Interesting. All right. So if you're out there, MSD online, right?
They go to MSD for Mothers.
For Mothers.
Yeah,
yes.
and they just search that. They'll be able to.
Let's do a quick search. If you check, so that we can lead the people there and to check so that they know the right place to go to. So it's MSD for Mothers. Though I know a lot of people know about it here, but then it's not bad to get new people to also know what they do. All right. So I mean, once you search, the first that would pop up.
Yeah.
That's a PDF if you know the first one. That's a landing document. Yeah. Great. So the first one. I mean, it's the first thing you see there. The next one, it's a document that says what they do and all of that. But the first one you can navigate, check, go, how to connect, how to be a part of them, whether how to volunteer or be a partner or be part of what they do here. All right. Let's also look at what are the projections you see for Africa using Nigeria as a case study in terms of ensuring that we kill cervical cancer the best way we can?
Look, I think there is a concerted effort across all the countries that we operate within to achieve cervical cancer elimination. Step number one is to ensure that the vaccination efforts are spread across all eligible countries. On the African continent, there's still about 15 countries that do not yet have pediatric vaccination programs. And over the coming years, we continue to work with those countries to try and ensure that they're able to introduce vaccination programs. We're very happy that this year Ghana will be launching their program. Namibia will be launching their program. So on a year-to-year basis, there's an expansion of the number of people that have access to these vaccines. I think thereafter, we really are looking at how we can ensure that African countries can have access to higher valency vaccines. So currently, the vaccine that is utilized the most on the continent is a 4-valent vaccine. And we really are looking at how we can sustainably ensure that we can give access to African countries the 9-valent vaccine. And I think thereafter, what will also be happening on the African continent is broad-scale expansion to boys. Boys have access to the HPV vaccine as well as what we call, I was told never to say older women, but rather say mid-adult women.
Okay.
Because those women between the ages of 20, say, and upward to 40 or odd are also at risk of encountering the HPV virus and need to be provided with protection as well. But as with all things on the African continent, you have many unmet needs competing for very limited budget. So all of these things happen in a sort of systematic way. So, we're starting with the 9 to 14-year-old girls now. We'll expand to boys and also expand to mid-adult women. But there will also be private sector programs that allow those that can seek healthcare interventions on their own outside of the government ecosystem to go get those very same vaccines in the private sector ecosystem. But generally, I think we're moving in the right direction as a continent.
Interesting. I mean, I've just while you were speaking, I was looking at MSD for Mothers and looking at some of the work that you do. I mean, just here on where we work, there's also data there that says we have supported more than 275 programs in over 73 global sites across the world. And I mean, that's huge.
Mm-hmm.
And then looking at your work in India, in Kenya, in Nigeria, in the United States, and also the global grants. Let's explore, I mean, some of this work that you do, and if there's any need to call for volunteers who would like to join.
I think the most interesting work that one of the projects that I'm quite excited about, and I must state that the MSD for Mothers work is a foundation that runs outside of the commercial ecosystem, and we do that specifically because our commercial endeavors as an organization shouldn't influence the decisions they make and which projects they get involved in. But one of the projects that I'm quite interested in and I've followed and has given me a lot of learnings is the City Cancer Challenge. In fact, Abuja is one of the cities that were selected to participate in the City Cancer Challenge. And basically what it is, it's a grant that we give an external organization that works with various stakeholders within particular cities to map out a plan that would create that city into or help those policymakers to have a plan to build that city into sort of a center of excellence for dealing with cancer. And certainly for me, that has been it was quite eye-opening. I think the last time I was here, I did a stakeholder visit with them because it really showed both the good and the bad. But what it really did do was also show that there was a viable track towards creating an efficient oncology ecosystem that could rival any in the world.
All right. Stanley is here and he's interested to bring us back to HPV. He says, please, when you find out that you have HPV virus as a man, what do you do? What's the danger? And how can I get the vaccine?
Yeah, so I must, first of all, always say that the most advisable thing to do for anyone with regards to healthcare queries that you have, if you discover anything, on your body or with yourself, is your most trusted source of information is your healthcare practitioner, your doctor. Always have a direct conversation with your doctor. But it is not uncommon for men to contract HPV. And that's why we speak of gender-neutral vaccination. HPV, in the majority of cases of people sort of encountering it, it will clear the system, your immune system will clear it by itself. But there is a percentage of people that that HPV virus will lead to downstream complications, such as, particularly in men, penile cancers, could lead to anal cancers, could lead to some head and neck cancers. I think the one that most people would know of from a male perspective would be genital warts. And the HPV vaccines play a critical role in preventing those. And that's why we make this call and say that wherever possible, vaccination efforts across the globe should be age and gender neutral.
Is it a scare for men?
I think once people know, it is something that does scare them. I personally have been vaccinated. But I think the bigger challenge is that people aren't aware of what these things are, and more importantly, aren't aware that there are prevention sort of mechanisms to ensure that you don't have to carry the anxiety of dealing with such health challenges.
But how can men get vaccinated?
Go to your doctor and speak to your doctor about the probability of getting vaccinated, and your doctor would be able to either write you a prescription or be able to administer the vaccine. It is available in the Nigerian private sector. So you probably have to go to a pharmacy or a clinic, but your doctors would be able to have access.
All right. Hafsat here says, good morning, Effizy and our guest. What are they doing? What they are doing, it's quite interesting, and we look forward to seeing more of it in our rural areas. Hafsat says that. Hafsat, I can tell you that I've also pushed to him to know when the launch will happen, and definitely that is also going to happen. But they're already working with mothers in rural areas also. So you can check that out, Hafsat. You can check that on Google. Google is your friend, and you can check that out, and you'll see all of the information you need. But those who want to connect with you online, to just connect with you and know what you do, how can they connect with you?
They can go to our local website, www.msd.co.za.
Okay.
There's a contact us link there on the website. And they'd be able to engage with our local subsidiary through that. And all the information around the various projects and programs that we work with fully available on that website as well.
All right. Let's say the website again.
It would be www.msd.co.za.
All right. And before I let you go, what are your parting words for everybody listening right now, and also who are also watching online on YouTube?
I think my parting words would be that my one passion on the continent and what I'm trying to do would be to ensure that we build a positive health-seeking culture. What that does, it ensures that we're able to, number one, have early diagnosis. Far too often in my conversations with people on the continent, they'll say, I was struggling with this thing and I didn't feel this thing for months. And I think if we have an early health-seeking culture, you'll be able to prevent a lot of those things, but we'll also be able to ensure that preventative medicines in interventions such as vaccinations will be more widely used.
All right.
I think also making sure that people are aware, like that question that come up, that your most trusted source is your doctor.
Right.
Ask the right people the right questions and get validated information.
I must really appreciate you for coming this morning. Thank you so much.
Thank you very much for having me. Really appreciate it, man.
Thank you. And I wish you the best of your day. Enjoy the rest of your day and see you in August.
Fantastic.
All right. Abuja, that's the much we can take with Mr. Bashman this morning. But go check them out on all socials and ensure you follow what they do. All right. Up next is Fidel Castro with Bottom Line, and he makes his way into the studios right now. Stay with me. I'll be right back at the 11 o'clock hour to do some more talk.
This is Nigeria Info.